Hello, everybody. I'm Nicholas Snow, and this is the season premiere of Life Positive on PromoHomo.TV. This broadcast is coming to you at 6 p.m. Tuesday, September 19th, but we're here to talk about Desert AIDS Walk 2022 happening at Ruth Hardy Park on October 29th, 2022. I have some very important guests backstage waiting to speak to you about the importance of this event. And this year, it's centered around the importance of LGBTQ plus health equity. The reason that I have the photo of David Brinkman, who is the Desert AIDS Project CEO and President, Executive Director, I've screwed up his official title. He put out a very important quote that I think is powerful in setting the tone for today's broadcast, and it's certainly setting the tone for the walk. So David says, "Unfortunately, history is repeating itself," says David Brinkman, CEO of DAP Health, which, as you know, is an advocacy-based care organization that provides service to more than 10,000 individuals annually throughout the Coachella Valley, and I'm one of them. He continues, with queer rights falling under attack across our nation and government's dispiriting lack of urgency in responding to the growing monkeypox crisis, 2022 looks, sounds, and feels just like the early 80s when HIV/AIDS was decimating our community and politicians turned their backs, refusing to act. As we learned then, silence equals death, and when our leaders abandon us, it is up to members of our community to join forces and advocate on our own behalf. Only by coming out in unprecedented numbers and raising our collective voice this year can we show local, state, and federal officials that their apathy concerning LGBTQ plus people is absolutely unacceptable. So those are very powerful words from CEO of DAP Health, David Brinkman. And with me, I have a variety of guests representing key partners in this year's walk coming up very soon.
I'm Scott Nevins, DAP Health Board member, inviting you to join your friends and neighbors this year at the 2022 Desert AIDS Walk on Saturday, October 29th. This year, we'll walk out loud for LGBTQ health equity. We're using our voices and our feet to advocate for members of our community that don't have the access to healthcare that they need and deserve. Together, we're going to help connect more people to wellness. Lace up your walking shoes, join arms with your community, and be an advocate for change.
And I'll be right back with my guests. And this episode is live on September 20th at 6 p.m. and thereafter. And I already have one of my regular viewers and friends who already says, "Love this, well done." So we're capturing people's attention. And without further delay, I want to introduce one at a time. Here's James Lindquist, Chief Development Officer at DAP Health. Patrick Jordan, who's chairman of the board of directors at DAP Health, and Scott Morey, who is the chief nursing officer of Desert Care Network, part of which is Desert Regional Medical Center. Welcome, gentlemen.
Thank you.
Thank you.
So, James, I want to start with you. And first of all, I'm going to go ahead and put onto the screen how people can register to walk in Desert AIDS Walk. That's a key message during this broadcast. But, James, I'd love for you to speak to the quote that I just put out there from David Brinkman and the conversations that have gone inside DAP Health to set the tone for the importance of this year's walk.
Yeah, so thank you, Nicholas, and thank you for letting me be on this and for your support. So I think this year, this last year, we've seen a lot of our rights being attacked. We felt that it was time for us to stand up and really just get our voices out there. And really, as a community, we have so many people that really, have been impacted by what we've seen this last year. For almost 40 years, we've been walking for people living with HIV and AIDS and either remembering them or honoring them, and we still are going to do that. But we thought this was the time to advocate for people that, women that are being, their right for reproduction rights are being attacked, just as transgender people's rights are being attacked, Black people, brown people, Indigenous people, our LGBTQ community, and there just doesn't seem to be a stop to it. And we can't stand back and be upset about it anymore. We really have to be able to have a safe space where we can all come together and really have our voices. And, as we say, it's walk out loud. So it's, walk because it's the walk, out because of LGBTQ, and out loud, meaning that, to hear our voices.
Fantastic. Well stated. Tell me, James, how did you personally become connected with DAP Health? And why is dedicating your professional time and energy so important to you and in many ways, one of your key life purposes right now?
So I became positive in 2004. And when 2004, I had a lot of shame about it. And I got connected with an agency called Cascade AIDS Project that's in Portland, Oregon. And they helped me to get services that are very much like DAP Health. They helped me with getting medical services. They helped me with getting food, rental assistance, that type of thing. And it wasn't until 2008 I started with an organization called Our House in Portland, Oregon, where I felt like I could first find my voice and really accept being HIV positive and understand that, HIV doesn't have me. I may have it, but it doesn't define who I am. And in 2016, I was at a point in my life where I was deciding if I wanted to stay in Portland or move to Palm Springs. And I'd always heard about Desert AIDS Project at the time. And a really good friend of mine had been doing a lot of work with Desert AIDS Project. And when I first moved here, I said, one day I'm going to be the director of development at Desert AIDS Project, DAP Health. And, 3 years ago, approximately, I started the journey here as the director of development, and I couldn't be happier.
Well, that's a very beautiful story, and I'm not sure I knew that part of your story, James. I'm also living with HIV. I'm also a client of DAP Health. One of the reasons I launched this specific series is to spotlight people living with, impacted by, or working to bring about the end of HIV and AIDS. And so the guest on this show would fall into any or all of those categories, and you happen to fall into all of them. So thank you for your truth and your power. I appreciate you.
Thank you. Yeah, and I just think, it's like you and you as well, Nicholas. It's like, we are examples of people living with HIV, and, we don't let it, like I said, we don't let it define us. And there's so many people out there that need that voice. And you and I and thousands of other people can be that voice at the walk this year to show people that we're here for them. We are examples of living with HIV, and that we just want people to know that we're here.
Well, thank you for that. And the walk is filled with allies and community members and other participating organizations as well. And we'll get more into what happens on that day. Patrick Jordan, chairman of the board of DAP, I would love for you to also address this overall theme of health equity, sort of how we're kind of reliving and being re-traumatized of those of us who were around in the early 1980s. And why it's so significant and more important than ever to step forward and support DAP Health and to participate in a walk like this.
Well, First of all, Nicholas, again, thank you very much for putting a spotlight on the advocacy work that you do in the community. And listen, I always say, from the ashes rises the phoenix, the quote, and can't be more true, right? Especially with the walk this year. So from a time when DAP Health started, we were literally in a basement over on Vela Road, and there were 3 people, and we were taking care of a community that no one wanted to take care of, right? So here we are, 38 years or 39 years later, whatever the date that, I can't remember the exact anniversary date, but it's something about that, 39 years later, as DAP Health. So from that, we've learned to care for our entire community, right? And so we've been faced with a pandemic, right? We were one of the very first organizations in the state of California, if not the first, to open up a free COVID clinic for everybody in our community, because we are inclusive. That is a key factor. And here we are now with monkeypox, right? And so, which, this is what we do at DAP Health, and this is what the healthcare community does, along with our partners at Desert Healthcare Network, right? We come together as a community to take care of everyone. And so from that lesson of 38 years ago or 39 years ago of being shunned in a community where nobody wanted to take care of these people, we know that we learn from that lesson that we take care of all. And there's a way to do that in a dignified way, that we make sure that everybody is living their best life to the best of our ability that we can. So that's why this year, when it says walk out loud, let's talk about it. Let's walk out loud and come together as a community, whether you're gay or you're straight or you're trans or whatever it is, you're purple, you're green, it doesn't matter. The event is a fun event, raising money and direct care for the clients at DAP Health. And that is what I'm passionate about.
I love that. And when I first heard the theme "Walk Out Loud," I thought, yeah, that's a great theme. Before I move on to Scott, and thank you for your patience, Scott. Patrick, tell me about how you became involved with DAP Health and how you progressed to your position as chairman of the board, and why, among all the philanthropic efforts you could be involved with, you have chosen to be involved with DAP Health.
Well, it's a no brainer for me, a gay man living in New York in the 90s, when I saw so many people decimated, and I was working with an organization then, and I used to be in the entertainment business, but I was working with which was actually started off as the Elizabeth Taylor AIDS Foundation before it was even that, actually, and that from that became the Elton John AIDS Foundation, and I was involved in that when nobody wanted to talk about HIV or AIDS. And so, cut to moving to the desert full time, met David Brinkman. This is a something that I've been involved with, as I mentioned, for years and years and years. I think I did my first walk in either 2006 or 2007, and something that we have raised funds for since then every year. In 2011, I was asked to be on the board. I was honored with the PFL award. I'm not into the look at me kind of thing at all. But I was honored.
Would you do that again? Would you do that again? That was very good. Yeah,
know
we
who I
all
am.
liked that.
Yeah, that's not me, as James can attest to. But so at that time, I became involved with the board, and I've been on it since. So became the vice chair, and then when you become the vice chair, it's when you're being groomed to be the board chair. And since that time, the organization has changed dramatically, and we care for actually 12,000 patients today. And that number will be going up to 25,000 people in our community, right? So from the marginalized to the people that have full boat insurance, we take care of everyone, but primarily the marginalized in our community. And to me, is something that I'm passionate about, whether you have HIV or AIDS, or you've got monkeypox, or you're a trans person, or you are looking for food insecurity, housing insecurity. And as you know, Nicholas, we cover a lot of territory on one campus. And we're also able to do that, as I mentioned earlier, because of our partnership with people like Desert Care Network, which donated $3 million to DAP Health in the past, and it was a big sponsor this year. So we're eternally grateful for that. So anyway, long story longer, that's how I got here.
But these stories are really powerful. And Scott, before I bring you on, James, I'd love for you to talk about the importance of sponsors like Desert Care Network. I should come work for you, the way I set up these questions. But I would love for you to talk about the importance of sponsors like Desert Care Network and why their presenting sponsorship is, in fact, so vital.
I think it just shows the commitment to the community. Desert Care Network has such an outreach into our community and helps so many people. They have a lot of the same values that we do. They believe in a lot of the same things that we do. It's just such the relationship is just so natural. And with sponsorship, we find ways to really connect with people and with organizations and with companies that also match with their values, match with what they're trying to do in the community, help them to outreach to the community. And I think, especially at events like this, where, we're going to have Desert Care Network is presenting, and then Walgreens are presenting for our Wellness Village, where we'll have over 40 vendors that are from our community, as well as nonprofit community sponsors. I think it's just so important. And, Desert Care Network, what I love about it is that, when we had the conversations with Linda Evans and other, and with Michelle, it wasn't even like really a conversation. It was like, of course, yes, we want to do this. And it's just been so nice to have that relationship with them. And the more that we can do to help promote them and the work that they do, it's just been, it's been a pleasure working with everybody at Desert Care and at Desert Care Network. And thank you, Scott, for being on here tonight. Just everything you guys do in the community. Thank you.
And I just want to take a moment to acknowledge our viewers. So Rock May is watching from Fargo, North Dakota. He says I am here, my beautiful soul. And Paul Jasek says, thank you all for your service, and discloses that he's been HIV positive since 1988. James Calvert particularly appreciated the discussion about unity. And then Rock is disclosing that he's been HIV positive since 2004. So those are other people who are out and about disclosing their status and being part of the solution. So I really do thank you for your patience, Scott Morey, Chief Nursing Officer of Desert Care Network. And thank you for your patience. Last but certainly not least, tell us from your perspective why your support of this event is so important, and how come yet another year you're stepping up to offer such generous support.
No, for sure. I believe Patrick stated earlier that DAP Health wants to be inclusive of all, where people could come and seek healthcare in a safe environment, have open, honest communication with their healthcare providers. In Desert Regional, we have been caring for HIV/AIDS patients back since the early 1990s at the start of the AIDS epidemic. Desert Regional is known as Desert Hospital, and we were fortunate enough to have some volunteers help us convert rooms in our East Tower to make it more like a home-like setting where patients and their families could be cared for in an environment where it was non-biased and not judgmental. And we found that very important to do. Since then, Desert Care Network has had an unbelievable relationship with DAP Health, where our relationship goes back for decades. We're very proud to support their programs and services. As James stated, that our philosophy is the same, just to care for all and be supportive and have equal access to care.
Well, thank you so much for your service, not only of the organization, but you as an individual. I know that you have worked for the parent company of Desert Care Network, Tenet Health, for more than a decade and a half, I guess. And you've had experience with the delivery of healthcare in many different cities. And I was wondering if you would give your own reflection and observation of what sets Palm Springs apart, either favorably or unfavorably, in terms of the way that other cities might approach these topics, such as HIV and AIDS and LGBTQ plus health equity and issues like monkeypox. How does Palm Springs rate from your travel perspective?
You know, Palm Springs is considered a gay destination, and prior to relocating to Palm Springs in 2018, I lived in Phoenix, Arizona, and healthcare in Phoenix was accessible, but they were not welcoming to the LGBTQ community or some minorities. And I think what makes Palm Springs stand out is one, it being a gay international destination, but two, we have two healthcare organizations really committed to providing care to everyone and just making them feel welcomed. Desert Regional was recognized as a leader in healthcare equality by the Human Rights Foundation campaign, and we're proud of that. And our philosophy is to make sure healthcare is accessible to all, and all feel welcome to receive that care.
Fantastic. Well, I'm sure by now viewers of this episode are very inspired. So, James, what happens when they go to desertaidswalk.org?
So if they go to desertaidswalk.org, they have the opportunity to register for themselves. Once they do that, they can choose to either join a team or to create a team of their own. And one of the things we always suggest is that when you register yourself, please make a donation for yourself, because the more you promote that to your friends and family, coworkers, and they see that you're supporting yourself, they know that you are supporting an organization and an event that really means something not only to you, but to who you are. And so once they register for that and you create your teams, you have the opportunity to do fundraising. And then as the weeks are going by, you will get emails from us to talk about, how to help your fundraising or how to help create your teams or did a little tips and stuff. And then we'll be also slowly sending out information in regards to the event itself and what people can expect.
Oh, well, that's fantastic. So Lance has tuned in. He says, sorry we're late. And he's shared with me that he's been HIV positive since 1996. And he's one of those rare people that's never needed meds. There's a scientific story behind that. But he's never needed HIV meds. That is a rare situation.
Amazing.
Yes. Now, before I continue and ask each of you if there's anything else you want to stress or add or have final closing remarks, I want to offer a public service announcement that I'm sure all of you will appreciate, and you will remain on camera while I'm showing this screen. And this is the screen that I want to share with you. So, and I'm going to remove that banner so you can see the screen in its entirety. So, as you know, monkeypox is in the world and different communities are responding in different ways. Riverside County has a scarcity of monkeypox vaccine, so healthcare providers in the county are prioritizing the distribution of that vaccine based upon very specific risk factors. And there are ways that you personally can seek out more information and be screened for those risk factors and put on a faster track to the vaccine. And if those of you seeking more information learn that you are not at high risk from monkeypox, then you can get on a list that will notify you of opportunities for vaccination when the broader community has access to the vaccine. So the Riverside County Department of Public Health has a monkeypox vaccine interest form. And you can find a link to that form at the website on your screen, rivcoph.org/mpx. DAP Health is operating a community-wide monkeypox hotline, and anyone from the community can call the hotline. And there's a misunderstanding that you have to be a DAP client to access services, monkeypox services at DAP. You do not have to be a DAP client to access monkeypox services at DAP. And both that phone number, the 760 phone number, and the website address on the DAP Health website will provide you with more information. Did I tell you, gentlemen, anything you didn't already know in that public service announcement? Or were you all up to speed on that information?
That's great.
Up to speed, yeah.
Okay, fantastic.
How we take care of the community, right? Unity.
Yes.
Everybody.
I'm so glad we got that information out there.
Yeah, I just would stress one thing as far as the interest form. The more people we get that fill that out, the more people are going to see Riverside needs the vaccine, and the more opportunities we're going to be able to get vaccines here. So the more people we can get that fill out the forms, the better for us.
That's really fantastic. So I'm going to let Scott Nevins do his thing again, and I'm going to come back to all of you for concluding remarks.
I'm Scott Nevins, DAP Health Board member, inviting you to join your friends and neighbors this year at the 2022 Desert AIDS Walk on Saturday, October 29th. This year, we'll walk out loud for LGBTQ health equity. We're using our voices and our feet to advocate for members of our community that don't have the access to healthcare that they need and deserve. Together, we're going to help connect more people to wellness. Lace up your walking shoes, join arms with your community, and be an advocate for change.
Yay, Scott Nevins. Okay, so Scott, what would you like to say as a concluding remark?
You know, I think it's clear that Desert Care Network and DAP Health share the same philosophies for caring for our community. And we are honored to be a partner of DAP Health to support their organization and their various community activities. The team here at Desert Regional is looking so forward to being out loud and proud with everyone on the walk. It's going to be nice to have everyone again in person. And we find it to be an honor and a privilege for the partnership and care for our community. And we thank you for that.
Well, thank you, Scott. And Patrick, what would you... Oh, by the way, Patrick, I know your team has been the #1 fundraising team for how many years in a row?
Well, for a while. It's a lot of pressure, though, Nicholas.
Okay, what would you like to say in conclusion?
I just want to say, first of all, thanks to Scott and to Walgreens, Desert Care Network and Walgreens, because I don't know if it was mentioned earlier, but the other thing to remember is 100% of the funds that are raised go to direct care. Network and Walgreens, because I don't know if you mentioned earlier, but the other thing to remember is
you're watching and listening at the same time. So sorry about that. Somewhere on your browser, this show is open.
At the same time.
So I have no idea what's happening. So let me try muting you to see if it's your computer. Okay, it's not your computer, so let me do that. Oh, I'm sorry. We have Ghost in our broadcast. So I have no idea why we're having feedback. Anyway, thank you for that.
Ghost in our broadcast.
I don't know. One of us has this show playing somewhere, and I don't know what to do about it. So we're just going to go with the flow. And James, what would you like to add?
Again, just to say like what Patrick said and what Scott said, thank you, Desert Regional, for your support these many years, Walgreens for your support. We still have opportunities for people to sign up to be walkers, to be teams. We still need sponsors. We still need people to sign up for vendor booths. We also want to say thank you to Cisco and Coffee. They're bringing breakfast and lunch. We're going to have the Palm Springs Animal Shelter there to do for pets. We have a children's youth activities booth. It's a 3-mile walk. Come out, enjoy each other's company, and just walk out loud.
Well, I want to thank all of you, and I want to thank the ghost that has occupied our broadcast in the home stretch. I encourage all of you to go to desertaidswalk.org for more information. And for you gentlemen, I appreciate the time that you took to be with me tonight. It means a lot to me.
Thanks, Nicholas.
All right, you guys, have a wonderful night.
Thank you.
Bye-bye. I'll see you all next time.